Good evening, everyone. I'm Jenna Brown, the National Director of Development at the Spina Bifida Association, and more importantly, a direct beneficiary of our organization through my 9-year-old daughter born with spina bifida. I'm honored to be here with you today alongside my colleague, Stephanie Myers, who is our individual and corporate giving manager. Also joining us today is Nancy Gore, who you'll see on camera, who's our board chair, and then I'm going to introduce our other guest of honor as well in a minute. Before we begin, I want to let you know that we will be recording tonight's session so that those unable to attend can still benefit from this important discussion. We also encourage you to engage with us. Please feel free to ask questions throughout the conversation. First and foremost, we want to extend our deepest gratitude to each of you, our dedicated supporters, partners, and advocates. Your generosity and commitment in 2024 were instrumental in advocating for our mission. Because of your investment, we continue to empower individuals and families living with spina bifida through education, advocacy, research, clinical care, and support. The work we do would not be possible without you, and we are truly grateful for the impact you make on the spina bifida community. Tonight, we have an exciting discussion ahead. Our President and CEO, Sara Struwe, will be sharing insights into SBA's strategic plan and what the future holds for our organization. With over 15 years of dedicated leadership at SBA, Sara continues to drive meaningful change and strengthen our impact nationwide. With that, it's my pleasure to introduce Sara Struwe. Please join me in welcoming her.
Well, good evening, everyone. As Jenna said, I have prepared a presentation, but please don't let that stop you from asking questions and having a discussion with me around this. I want to talk a little bit about where we've been with our strategic plan and what's up and coming. And I want to close with some conversation around what's happening around us in the federal government and how that's impacting SBA and our community, and have some time to talk with you about that, because I think it's something that's on pretty much everyone's mind at this point. So with that, we'll go ahead and get started. So, our strategic plan had several parts to it, but these are the key, what I consider to be programmatic aspects of our strategic plan. To me, this is the meat of what we do at SBA. This is really how we try to build that better and brighter future for everyone impacted by spina bifida. And our focus really is on some key areas around healthcare. And we focus on healthcare primarily with SBA because first, we are a national voluntary healthcare agency. And secondly, we are the only organization that focuses on healthcare for individuals with spina bifida. There are other disability community and organizations that focus on wider issues around education, employment, transportation, housing, employment, all of those things, but we are the only organization that focuses on spina bifida as it relates to healthcare. So we feel very strongly in making sure that we're leaders in this arena, and then we partner with others in those cross disability group issues that we all face. So I'm going to focus tonight on pretty much what we're doing health related in the spina bifida world. So the first biggest part of our strategic plan is addressing gaps in the healthcare system, particularly for our adults with spina bifida. As you all know, there are very few adult providers to provide healthcare for adults, very little research done on adults, so we don't have much evidence in the best way to treat them, and we'd like to address that situation and build that evidence base. So we can start to learn what works and what doesn't work, and work on focusing on improving the healthcare outcomes for adults. The second piece of our strategic plan is around the newly diagnosed experience. So since I've been at SBA, as Jenna said, it's been over 15 years. It's actually close to 17 years now. But since I've been here, this has been a universal story that I've heard from parents who've just found out they're having a child impacted by spina bifida. It always goes something along this line. Now, whether or not this is actually what happens or whether or not this is what people feel like happens, I'm not quite sure, to be honest with you, but perception is kind of reality in this situation. So I think we have to err on this is what's actually happening. And it goes a little bit like this. I'm sorry to tell you your child has spina bifida. When would you like to schedule your abortion or termination? And, we believe people make their own decisions about their bodies and um, the pregnancies that they carry. And we don't think that healthcare providers should be automatically deciding whether or not a woman should have a termination of a pregnancy just because the child has spina bifida. We really feel strongly that parents need to be given all the evidence out there so that they can make an informed decision and then let them make the decision as to what they need, what they want to do. And so we're trying to kind of change that dynamic and the trauma that comes along with that, and have been working very hard with partners across a couple of different agencies and groups to try to change this narrative. Another thing is focusing on building our community. We know that individuals in our community feel very isolated and alone in a lot of instances because of transportation issues, because of their bowel and bladder issues, a multitude of other issues, that mental health issues that come into play, all kinds of things. And so we're trying to figure out ways that we can help build community for individuals with spina bifida. We also, I mentioned that there's not a lot of evidence on treatment of adults and what works and doesn't work. And so we feel like we need to really get better evidence so that we can make better decisions. And it's not just about treatment options, but we just really don't know that much about the lifespan of people with spina bifida, what they face. We don't know what kinds of comorbid conditions that they have as they age, how aging impacts them, if it happens sooner or later than the general population. There are a lot of things that we don't know. And so we want to figure out ways that we can try to start developing some of that evidence. And I think part of the way we'll do that is through our big drive around our community-centered research agenda. Several years ago, we did a survey of our community about the things that impacted their life on a daily basis the most. And there were 6 topic areas that were identified that were pretty universal across all different groups: adults with spina bifida, parents of children with spina bifida, and adults and parents of adults with spina bifida as well too. And so we'll talk a little bit later on in the presentation about some of the work that's being done around that. Those are the main points that we're going to kind of highlight tonight. Jenna, go on to the next slide. Our first slide is around that first part of the strategic plan around reducing those care gaps. And our goal really is to make sure that people have better access to informed healthcare providers, equipment, supplies, anything they need. And so we're focused on a few things in this arena because we can't do it all, but we looked at the things that we felt like we could have an impact on relatively quickly for in some instances and more long-term in other instances. And so we really are keyed in on trying to figure out how we can increase the number of adult care providers who are knowledgeable about spina bifida and willing to treat people with spina bifida. The other piece of that is to advocate for reforms of insurance issues that make care more affordable for people. And then we want to make sure that we collect information and share it to providers and collect information on resources as well, and provide that information to families and individuals with spina bifida. So as we focus on this, the training gaps in spina bifida healthcare, our big goal is we just want to provide more healthcare providers to treat people with spina bifida. We want to connect more adults with the adult providers that we do know. We want to reduce gaps in care where we can because we're able to connect individuals, and again, advocate for better insurance coverage and get more information about adults into our spina bifida guidelines for the care of people across the lifespan. And then also update and create guidelines and information sheets as necessary as more information and evidence becomes available. That's the primary way that we connect with people initially around topics, and we have a plethora of those, but there are new ones that get identified every day, and we work in conjunction with our professional advisory council, the PAC, to do that. Some of our current projects around training of healthcare providers. So we've drafted what we call SB 101, which is just the basics that an adult healthcare provider needs to understand about taking care of adults with spina bifida. So I tell this story and people think I'm joking, and I'm not joking. The fact of the matter is, I can't tell you the number of adults who've come up to me and said, I went to a primary care physician the other day, and no joke, they asked me, when did I get my spina bifida? And so that tells you that there's a lot not being taught in medical schools about spina bifida and probably other congenital conditions as well. And then the other piece of it is I went to my primary care physician not too long ago. It's a different one than I have now. And the primary care physician said to me, you have a job? You work for the Spina Bifida Association? Folic acid took care of that. There aren't any more kids being born with spina bifida. And I was like, oh, we've got a lot of work to do. And so it's just abundantly clear that we're going to have to step in and help on this issue because medical schools are not doing it at this point. And so that's a couple of things that we're working on. Like I said, the training, but also we host every year and invite more and more physicians to come to our clinical care meeting, which is really all about how you clinically care for people with spina bifida, regardless of their age, children or adults, either one. Specifically around adult healthcare providers, we are working on developing a searchable database for adult healthcare providers. We've located a source that can tell us what general practitioners and other specialists have adults in their practice, and we are now able to reach out to them to find out if they're interested in taking more adults with spina bifida and if they'd be interested in some training that could help with that and support from SBA. And so we're in the middle of developing that list and the database right now. And also identifying adult healthcare providers that actually treat adults with spina bifida currently, and then any other ones that would be interested in learning more so that they could be ready to do that. So those are our current projects that are underway now. One of the other things that we're working on is determining what effective clinic models really are. We're engaged in a best practice benchmark project. I'll talk a little bit more about that later on down in the presentation. And then we're really interested in seeing if we can develop, find some funding and develop some studies to compare outcomes of the variety of adult clinical care models that are out there for people with spina bifida. Is there one best, or are they all equal? What do we think could be picked up more in terms of reimbursement for physicians? All of those things will come into play if we can get some funding to be able to do that kind of work. So those are a couple things that we're focused on currently. We're also working very heavily in the pediatric to adult care transition space because, quite honestly, that is an area that was identified by our community as something that has a huge impact on their lives, and it is the time frame that kids fall off the care cliff. And if they can't find a provider after they age out of the pediatric system and they can no longer be seen at a children's hospital, then they fall off the cliff for a while, and sometimes it leads to some dire consequences. And so what we're hoping to be able to do is really focus at some point some of the federal work around transition, specifically on the policies that are necessary to make this happen. I will tell you that this is probably going to take a little bit of a pause for the current time because honestly, with everything that's happened within the federal government, I don't foresee us being able to make any headway very much in the near future. So we're going to shift a little bit, and we talk about growing impact, which is our national partnership for pediatric to adult care transition group that we've pulled together that was originally supposed to focus on um, policy. But I think we're going to see if we can work a little bit in the interim on basically some research around what's happening within transition or not happening within transition, because I just don't feel like we're really going to be able to make an impact in Congress right at the moment or with the administration. Um, we did hold a briefing last year on transition with members of Impact as well. I hosted it, or I moderated, I should say, and we had folks from Every Life Foundation and a local clinic here at the Children's National, which is very involved in spina bifida, and also with SBA to talk about this issue with congressional staffers. It was pretty well attended, so that was encouraging. But as I said, that was last year. Things have changed dramatically. But our professional advisory council is also working on a survey of clinics on what they're doing to prepare their patients for transition. So those are things that are currently underway or have just immediately happened. Under that goal of improving insurance coverage, we really have focused on a couple of things this year that have been pretty successful. The first of which was we were able to get, in conjunction with our partners, able to get billing codes for catheters expanded from 3 to 6 categories, which allowed for separate coding for hydrophilic catheters. They are more expensive and were being reimbursed at a much lower rate. And by doing this, we can see that the reimbursement rates can go up for those hydrophilic catheters, so less money should be coming out of individuals' pockets because of that. The other thing was we were able to get TAI, transanal irrigation, a device used for bowel incontinence and becoming bowel continent. We were able to get that covered by Medicare as a prosthetic. They had originally classified that as an enema, and enemas are not covered under Medicare. Classifying it as a prosthetic means that it can be covered under Medicare, which means that it's more likely to be picked up by private insurance as something that they will cover as well. And so that was what we feel is like a pretty big win. And then we're currently working with others on a system that allows wheelchairs to be secured in various modes of transportation, whether it be cars, trains, or planes, that don't require people to be removed from their wheelchairs, number one, and number two, don't have to be strapped in as they currently now are on buses and other automobiles, because most people don't really know how to strap people in correctly. And so it's a safety feature, but we're working on that in conjunction with others at the moment. And then we're working on drafting legislation to provide insurance coverage for orthopedic shoes for people with spina bifida. It's a pilot project. We hope in the second half of this year or next year to be able to introduce that legislation. But again, a lot of it will depend on what's going on with Congress at that point in time and if it's really functional or not. When we talk about standardizing adult care, some of our current work is that we've worked on updating and distributing guidelines for the care of people with spina bifida as new evidence arrives. And then we've also renewed our 30 SBA clinical care partners, which when you think about clinical care partners, think of them more as centers of excellence. They have a set of standards that they have to follow in order to be classified as one of these. And those standards range in a lot of different areas and have actually helped to improve some of the base treatment that's coming out of our clinics. Really, when we talk about informing and educating people with spina bifida and all their family members and other care partners, we provide a monthly virtual education series that reaches literally thousands, I'm happy to say, at this point in time. They're based on topics. Each session is based on topics. They're developed by the community and suggested by our chapter leaders, and oftentimes have experts that are not only real life experts, but actual professional experts in the areas that we're discussing. So it's become a very popular series. Some sessions are much more popular than others, but we record each one of those sessions and make them available for people after the fact too. And this is an example of what happens on those virtual education. You can see that we have a channel in YouTube, so you can go to it and you can subscribe. And when things are posted in there, you get notified of it. But these go on pretty much automatically right after the presentations are completed. We do a little editing with them, but not much. And so within days, they go up on YouTube and they're sent out to everybody who registers. The link is sent out to everyone who registers. Last year, we did 17 virtual sessions. We had over 3,600 registrants for those 17 sessions. There were 29 different presenters that were volunteer presenters involved in that, and over 3,900 views of our YouTube channel occurred. And that was focused, those sessions were focused on our community-centered research topics. So they were pretty popular. Now I'm going to switch gears out of the first part of the strategic plan and move to our second part. So it's around that diagnosis delivery, and it goes, believe it or not, all the way to about the third month, because there are some people who have an in utero surgery and correct the lesion that's on the baby, and those centers not always have a clinic attached to them, and so sometimes those babies after they're born go for a while before they get to a clinic, and so 2 or 3 months can go by, and that can lead to a lot of damage if you're not monitoring newborns, and so particularly in their kidneys. And so we've focused from that diagnosis all the way through pregnancy and into the first 3 months in this goal. And we want to improve the delivery of the diagnosis to parents. We want to basically reduce that stress that families go under. And we want to make sure people get access to accurate information, that they're not listening to something on the internet that somebody said but isn't not factual at all. And so we just want to make sure people get good, solid information that they can make decisions with. And then we want to make sure those newborns get connected. I apologize, but get connected to that qualified clinical care. That's really important. We're working on developing 2 new tools with our partners. There's a care plan for new parents, as well as an understanding spina bifida diagnosis document we're working on. In that care plan, The things that we want to make sure that we have are guides to spina bifida for those expectant parents, a document that talks about what to expect with babies with spina bifida, like not health wise, but just in general. And then a plan of care documents that can help um, new parents know what they need to do and when they need to do things. And that is two of those, the My Baby with SB and plan, the plan of care document is, or documents are still under development. We haven't completed those as of yet. And when we talk about that care plan, these are the things that will be included in that plan. Prenatal closure, postnatal closure, what to expect with both of those, information on adoption and termination, information on NICUs and what to expect when you're in a NICU with the newborn if that happens, which often it does, and then what to expect in those first 3 months as well. Another current project in understanding the spina bifida diagnosis is the development of that document, and it has been developed. It is up on our website, and this is linked to where you can find it if you're interested in looking at it. We also, for those newly diagnosed expectant parents, have created a support model. We've basically found volunteers who've been through this process, trained them to be a partner or a mentor, and then new parents contact us and we connect them with those parents, and they walk with them through that process. They can answer questions about what it's like to have a baby, what happened with your family, do you have other kids, how do you handle this. So it's putting them in connection with people who have already walked a mile in those shoes, and I think it helps people to feel like they have a connection early on, because one of the things we've also heard from a lot of new parents is that they just don't know anybody who's been through this process, and they feel lost because they get a lot of information thrown at them from healthcare providers, but it's the day-to-day stuff that they don't know that much or understand that much about. And so it's really important to be able to give them that kind of practical information to help them make those informed decisions. And also, I think, to be quite honest, to let them know that if they decide to have a child with spina bifida, it'll be okay. And your kid's not going to come out with two horns and a tail or anything strange. They're still going to be a kid. They may have a few extra challenges that they need some help with, but who doesn't? And they're kids first and foremost, and so they should enjoy having a child regardless. And so we want that to be the message for them. Another goal, which is really important to us because it's going to help us in that care piece, is really getting access to higher quality, more comprehensive, and community centered research and data. So we're focusing on that. We want to really expand data efforts in conjunction with the CDC National Spina Bifida Patient Registry, and also support additional research. We want to make sure that information gets shared and disseminated with people, whether it be clinicians, researchers, parents, adults, everybody who's in that ecosystem of care for people with spina bifida needs to be aware when things change. And then we also want to work with our research partners to generate funded research that advances our research agenda, that community-centered research agenda. So let's talk a little bit about the research agenda, the community-centered research agenda. It is comprised of 6 different topic areas. They are all listed here: bowel and bladder, continence, weight management, transition, self-management, and mental health were the top 6 topical areas that our community said had the most impact on everyone's daily life. And so we have developed a research council, advisory council that is working there's a group working on every single one of those topics. And they are comprised of adults with spina bifida, parents of children with spina bifida, healthcare providers, researchers, and in some instances, friends of people with spina bifida who are really interested in topics. And so it's a pretty robust group of people, and they work in conjunction with our professional advisory council. Under the area about incontinence, these are some of the studies and papers that are being worked on related to bowel incontinence, looking at some of the variation in bowel procedures that we see in the registry, looking long-term registry at what happens with participants from their childhood into their adulthood with if they remain continent across that span. We're trying to determine why that is the case and why it differs for other people. We're also developing a survey of adults about bowel management and the use of bowel management protocols that we developed. And then, of course, we also are looking at a study on what's called bowel boot camps. There are a few centers around the country that will take, it's like an intense training for people with spina bifida on bowel management. And they literally go away for this training for a week. And some people, it's been very helpful to, but others it hasn't. And so we want to kind of take a look at that and see what works and what doesn't work, and how things can be altered that might improve it. In the area of transition, there are papers currently on gaps that are taking place, and we're looking at things like the way healthcare providers can help parents support the children through transition, and then the way they can actually support transitioning adults in their practice to adult services. So under self-management, this is something that has huge impacts on your ability to care for yourself. And it's one of the areas that our adults are very challenged in, because as children, nurses really provide the function of care coordination that helps to kind of manage all this stuff. I talk about, I'm a patient with end-stage renal disease, and I have to manage my own care as an adult. I don't have a nonverbal learning disability. I'm pretty astute because I've worked in the healthcare field for a while, but I will tell you, I have challenges managing everything I have to manage for my care. So I can only imagine what it would be like for somebody who has those challenges cognitively in terms of ordering their life and all of those executive functions that most of our adults have. It's no wonder that they have such challenges with healthcare, because the adult care system is not set up for people who need help with that. The pediatric space is, but adult space is not. So anyway, self-management and the ability to manage yourself, particularly around care, come into play. So we really want to do a survey of adults with spina bifida. We've done one previously. It's probably been almost 10 years ago that we did it. But this one will have a little different slant to it. We want to, of course, focus on demographic data and condition variables, and how people feel like they're able or not able to manage their own medical needs, what their employment status is, what their social relationship is, what their living relationship is, because there can be correlations in those areas that really have an impact. And so we just want to kind of get a really good picture of that so we can understand better where there could be gaps that we might be able to fill in later. And we're really wanting to do a community-based study that explores what facilitates and what holds up self-management skills within our community in particular. Weight management is another area that's of great interest in our community, particularly by the adults. We're doing some studies now on what healthcare providers' beliefs around obesity are and how they can hinder or help. and then survey of adults to really find out what their expectations are and what they have gone through around weight management. I mean, one of the issues that we see in particular with people with wheelchairs, and it's not just in our population, it's in any population that uses wheelchairs to get around. And if they cannot ambulate on their own and are dependent upon that wheelchair to move around, is how in the heck do you get a really good weight for those individuals? Um, I have heard stories of people who have gone to the post office to get on one of the scales that they use for big shipping things, just so that they can try to get an understanding. And then they crawl and put themselves on it so that they can see what the difference is between their chair and themselves, and how humiliating that must be for people. So, we want to see what has to change in the health field for that. And we've already been working with the larger disability community, and there have been some rules that have come out recently that should help with this. But again, we don't know what's going to happen given the current climate in the federal government, because many of the agencies that would monitor that are ones that are in dire need of or may be disbanded. When it comes to urinary continence, we're really focused on this through the NSPBR, the registry, um, because quite honestly, that's where most of the data around continence resides. And so there are a few things that we're kind of looking at currently that we think would be kind of helpful. Is one of the things is looking at whether or not there's a link between how far somebody is from a clinic to their urinary and their renal outcomes. So does being further away make it worse? Does it being closer, does it make it better? And that could tell us that it's based more on how close you are to care and can get care close enough. And there are also some talks about how telehealth also connects in this as well. And then can you go back to that? Sorry, Jenna. The other thing that we're working is looking at what the long-term outcomes of both bladder and bowel continence programs are, kind of overlaying the two of them and seeing what we can learn. In mental health, we're working on feasibility studies to put um, some measure of them in the National Spina Bifida Patient Registry. And it was really going to focus on depression and anxiety, because those are the two areas that most people tell us that they have the biggest difficulty with. There are several hospitals working on this that are in the clinic, and we're looking at a particular, they call it the PROMIS mental health measure. It's a particular validated um, tool that we're looking at using. And then we want to gather that health data within that that um, schematic to be able to kind of look at in the registry what happens long term with mental health issues. Um, in around this area in our current projects, of course, we every so often hold the World Congress, and during that, a lot of information on research that has come out of the registry, as well as other projects that SBA has been involved in over the last few years, was shared and disseminated with researchers around the country. And in the off years that we're not doing a World Congress, we do our clinical care meeting, which really is about how research is put into action within a clinic setting, and what we're seeing, how people can do it, if people are following outcomes related to it, all of that, and share that in a hands-on kind of learning experience. So the good news about it, it's not we do it in conjunction with clinics who volunteer to host it each year. And it's not as large as the World Congress, it's more intimate. And there's a lot of networking that goes on. And it has really made a huge difference within our community that those clinics talk to one another now and learn from each other and brainstorm. And arrange research projects themselves. We also have advocated continually for the increase in funds in the federal government for the National Spina Bifida Program at CDC, which the National Spina Bifida Program is where the registry and the SBCCN are run through that funding mechanism. The registry we've talked a lot about, we'll talk a little bit more about, but the SBCCN has provided us resources as SBA to figure out ways to disseminate the information that's coming out of the registry and getting it in the hands of people with spina bifida. So it gets translated into those education series I was talking about, as well as it gets translated into fact sheets. It may go into guidelines. We may do special trainings with healthcare providers on some of the topics. So all of that, there's funding for us, or has been funding for us from CDC, to make sure that what comes out of that registry gets in the hands of people so it gets used and it does impact care earlier on. And then one of the things that we're interested in doing, and we're just in the beginning planning stages, talking stages about, is developing a patient-reported registry that would work in conjunction with the National Spina Bifida Patient Registry, but would really be our ability to focus more about adults and their lifespan, and not just treatment, not just outcomes and their conditions, but more other questions about those life questions, like, did they go to college? What's their degree in? And all the things that a natural history registry, as well as patient reported, could help us to better understand and get a better viewpoint of what's going on for our adults. So I've mentioned the National Spina Bifida Patient Registry, and we do work very closely, or at least have worked very closely, with the Centers for Disease Control and Prevention on specifically 3 projects. One is the National Spina Bifida Patient Registry. The other one is the Urologic Management to Preserve Initial Renal Function, or UMPIRE, and then the benchmark. And I want to run through these really quickly so that we can leave some time to talk. Our partnership really looks at data that comes out of the registry. It talks about all of those things: survival, healthcare outcomes, transition, interventions, and aging. And then we take what comes out of the registry and implement those activities that help people learn how to better care for themselves. Just a little bit about the registry. It was advocated starting in 2003, and for 5 years they worked to get it started. It was actually passed in 2008. 2009 collection of data began. And I think it was 9 clinics that were funded to do it initially. The focus on it is to improve care of people with spina bifida, and we do that through collection from spina bifida clinics who are funded and onboarded into the registry, and they collect clinical and demographic data from people who have consented to be in the registry. So far, there are about 12,000 people over the course of the 15 years that it's been running. They range in age from 0 to 89. 52% of them are female, 76% of them have myelomeningocele, and 65% of them are between the ages of 5 and 21. So that's the reason we're really interested in that other registry to augment this, is because this is a clinic-based registry. The other one would be a patient-based registry. And so adults could tell us more about what their care is like. And here's what we've learned about people who participate in the registry who are covered. 53% of them don't have bowel control. 69% do not have bladder control. And then 29% of them use a wheelchair only to get around. And 29% of them have had some pretty challenges around skin health. A lot of wounds. So the umpire program began in 2015 with 9 funded clinics that had to be a part of the registry, and it looks at and found out that children um, are really at risk of urinary tract infections, scarring of kidneys, and loss of kidney function. And we have been looking at bladder and kidney function of children with myelo mainly, or myelomeningocele, I should say. And then the whole point of this is to try to figure out what tests and evaluations and schedules and treatments are the ones that work best and when should they happen. So that's what this is trying to figure out. Right now, kids 0 to 10 are included in this perspective. It's an interactive um, experience that clinics learn from what they're doing and adjust accordingly. So it's constantly inverting itself, or reinventing itself, I should say, as we learn more. So it's a really interesting dynamic process that's had some pretty impactful information thus far. Again, I think we had 636 kids who had been enrolled in that 10-year cohort. It's babies only that get entered into it, and then we follow them longitudinally over the next 10 years. Um, and they have to have myelomeningocele. But what we did find out is that babies who are born with myelomeningocele are born with healthy kidneys by and large, about 99% of the time. Until this, we didn't know that. We always thought that they were born with wonky kidneys, but that's not the case. It happens in the first 5 years of life is when that starts happening. But one of the things we've been doing as a practice for a long time, now there was no evidence around this, but it was kind of like consensus based by experts, is because everybody thought that kidneys were wonky in those kids, they felt like they had to introduce antibiotics at a very young age, even when there weren't UTIs present, because there would be bacteria in their urine. Well, from this, we've learned everybody has bacteria in their urine who has spina bifida. Most of the time, it does not lead to an infection. And so we really shouldn't be giving those new kids those antibiotics early, because it's part of the problem of why people are becoming so resistant to antibiotics. Uh, Donna, when we talk about normal kidneys, there's a function level, and it has to be at a certain level before it's considered normal. And so kids with spina bifida are born within that normal category. That's what I mean by normal kidneys. It also means that there's no known kind of, they're not undersized or anything like that. So they're just average. It's what you'd expect to see in a child who's just been born. The benchmarking project is the other big piece of what we're working on with our clinics to better understand what works well in clinics that can influence outcomes. And so we're looking at 4 different areas, because we put bowel and bladder together, but they are kind of separate outcomes. Mobility and skin breakdown. Those are the 4 outcomes that we're looking at. And what we want to do is look at those system level factors that contribute to improved health, or can contribute to improved health. Is there dedicated nurse? All that changes because all the clinics are run totally different, and so we're trying to see what the commonalities are that happen in those clinics that have better outcomes in these areas. And then we want to make sure we tell people about it, and then try to get them to pick up some of those practices, or advocate locally in their clinic or in their hospital setting to get access to some of those things, because there will be some proof finally, at least some qualitative proof, that says that this can make a difference. So that's a lot of information to cover. I apologize that it ran long, but I felt very strongly that you all needed to get a really good understanding of everything we're working on, but not only that, an understanding of how we work in conjunction with CDC. And to be quite honest with you, we are so concerned. I'm not even sure CDC is going to last, to be honest, given the current state of the federal government. And I am almost 100% sure that we will not get additional funding. So we're going to have to find other funding resources to continue some of this great work. And you as partners need to know that. So I'll take any questions that we have. If you want to put your camera on and you can just shout out your question to me. Please don't wait to be called on. We're a little bit more intimate than that, guys.
Sara, this is Jay Whitehurst. What order of magnitude of funding are you worried about decreasing? What, kind of realistically, what's the range and what percentage of your budget is
So
that?
25% of our budget currently is funded by CDC funds. And all of that is all the work we're doing in the clinical setting is funded by that. And it's actually funding our time to work on projects like the newly diagnosed and several others as well too. So it's going to slow things down tremendously for us. We feel like things are slow as it is now, but it's really going to slow things down because we'll have to divert to things that we can find funding for, that are also on our list, but not as important. And of course, we're going to see if we can find funding for this as well. But who knows? Because right now, honestly, everybody's in this shape. We're all talking about it. It's the first thing that all of the healthcare groups, when we get together, that we're all talking about.
That's got to be very demoralizing. The
And particularly because we're housed in Northern Virginia, so it's really demoralizing here because we've seen so many of my neighbors are impacted by this, and they're good, hardworking people that have done some amazing work over the years. They, NIH and all kinds of places. So
One last question just for me, and this is on the optimistic side of things, maybe.
sure.
There's a lot of your strategic goals and projects have it seems to me they have a certain pace to themselves. You need other people to respond, and you've got a thing. You can only go so fast.
Right.
But among your strategic projects, which ones could go a lot faster sooner if you had the money, or just the money is what's holding you back, not other things?
Now, most of it's money. We've got and money equates to people, right? So, so all of that work right now, our programs, our research and service department has 2 people in it. And the marketing department has 1. And those are all really critical to what we're doing with the SBCCN in particular around clinical care, and translating that information into usable bites that people can consume and put in their daily life. So that's probably one piece of it that with more people we could do more. Research is another area, to be honest with you, Jay. We currently have, I think I counted, and we've probably got about 200 healthcare providers who volunteer in some way for us throughout the year. I like really stay engaged with us, not just like they're not just one-time people who drop in and do a small thing for us, but some of them, we have a volunteer right now that's coordinating all of that community research. I mean, I'd love to hire her, and she needs a job, but we just don't have the money, and she's so passionate about it that she's doing it as a volunteer. But we have a lot of people that we work with who are really passionate and just doing this out of the goodness of their heart at this point. But there's only so much you can do that way because you have to work around the schedules that they have. And so if we had more dedicated people who could work on, basically the development of the programs and services, the marketing of it, that would be very helpful to us. And so I really see those first, we set it up this way. The first two goals are the first two goals. Like it's the care gap and the newly diagnosed. We're close on that too. I mean, with a little bit of money with that, we could probably sprint to the end of the development and get right into the dissemination piece, working on the dissemination piece, which is really, we want to get that in the hands of OBGYNs across the country. And we've got some ideas of how we can do that, but we need money to be able to do that, obviously, and personnel to make it happen as well, whether it be as consultants or staff. But we won't be able to go very long with just volunteers doing it, and we won't get very far. And then the data piece is really just more like, that is also very connected to that first goal. And with it, we need funds to be able to get access to the data. There's a lot of data available, but you have to buy it. We have access right now to one database, and we got a deal on it for a year. We worked really hard, and it was thanks to one of our board members who worked with one of the companies and was able to get us a deal so that we could get access to this information for basically a year. But we're going to need access. And it lists doctors across the country that are actually providing care right now, down to their email addresses. So it's a way for us to really market and start to grow that population of physicians within our community. And that's one of the things we want to do. But we also need personnel to help us really be able to do that well. So it's going to take us a while, given the way it is now. But with that money coming out of CDC, it's going to take us even longer. So that's my concern. And we will then, at some point in time, have to look at our strategic plan and decide what we're going to drop, because we won't be able to continue to do all we're doing. And as you can see from this presentation, we only have 12 people on staff. So if it weren't for the cadres of volunteers that we have enlisted over the years who have developed great working relationships with us, we can do this. But it still takes more than I have in terms of staff to be able to do this and continue to do it well. And we're all pretty bought in on this. I mean, we really believe in what we're doing. I mean, I've been here 17 years, so you guys got me. I'm hooked. I'm going to retire from this place because I just really feel like we've got work to do, and these people have been left behind too long.
Great. Thanks. I appreciate that. Thank
Sure.
you.
Sarah, Donna has a question that I can
Yeah,
read.
I see that, Donna. Well, I know right now I haven't looked at forecasting for anything beyond what we're doing, right? So we have to fill that $450,000 loss. It'll be about $120,000 this year, the latter half of this year, because their funding cycles are really strange. But next year we'll have to make up a full $450,000 out of that. We're continuing to try to replace that with large grants on some of these projects. We've been successful in 2 projects this year around the adult care piece. One gave us seed money to purchase the list that get access in the database that I talked about, and the other is around developing the curriculum and getting it out to healthcare, or starting to identify it with healthcare providers or educate people about it. So those that we know, but what I haven't done as of yet, we will do. We've just been kind of knee deep in everything thus far. Is sit down. We have a new chief operating officer coming in week after next, and one of the first things we're going to do is sit down and strategize around that, because we've got to look at how we can fill that gap, and then if we want to continue to grow, how we do that. So stay tuned. We'll have more information on that.
I have a question. Especially given the current climate, have you considered sharing, is there any sort of global idea sharing? I know in Europe they have done a lot of these transition adult spina bifida cares. Is
Mhm.
there any plans to kind of see what they have done, what data they have collected, and some sort of data collection sharing of ideas?
We share ideas with Europe in particular quite often. Many of those countries come to the World Congress and they actually follow us because of the National Spina Bifida Patient Registry and learn, believe it or not, we're kind of taking the lead in that. Um, some states, like some countries like Sweden, have a very robust um, registry of people with spina bifida, like a complete registry, but it's very small because they don't have many people with spina bifida there. So it's easier to do, and they're not as geographically diverse as we are. So, one of the things that we are considering doing, though, is learning from each other here in the States to start with, to be quite honest, because there's not enough of that that's going on right now. And I was just on a call today with my colleagues from the Hydrocephalus Association and from the Osteogenesis Imperfecta Association. And the three of us are going to try to go after some PCORI funding to work on trying to identify models of transition and the effectiveness of them, and what we can learn from each other. So we want to start off, we're going to ask for funding to do a conference, bring people together. We want to create a project out of that then we go get full funding for, so that we can kind of look at what many people in or organizations are doing. Um, but yeah, we've been connecting with colleagues a lot on this issue. That's where the idea for impact came from, because we were all saying the same thing. And one of the things that makes it more challenging to look at countries like Canada and Europe is our healthcare system is so different. So it makes it a little bit more challenging to try to figure out what, we may know that things work, but to get them funded here is a different story than in other countries.
A follow-up question to that is, are there plans to kind of develop a database, maybe not a database, but like a list of centers that does a good job of doing, whether it's,
Yeah. So,
children's care or adult care? I feel like that's
so
kind of
those partners that I were talking about, those are the what we consider centers of excellence that are doing all the right things, and most of them are us. Many of them, not all of them, but most of them are. Many of them are in the registry, and so um, we can actually compare outcomes within those situations too. So that's going to grow over the years. I think it'll be interesting to see what comes out of that.
is that data public somewhere?
No, it's not, because
Yeah.
CDC owns that data and they do not share it publicly.
But like the Center for Care, is that sort of data really available? Like say if we're, parents with kids with spina bifida, if we were to want to relocate, at least we know if we go to certain state, where should we seek care, what's good and
Yeah, well, you can start with that list of 30 clinics that's on our website. That's probably, we know the things that they're doing. Like they've told us how they handle transition. They've told us how they do care coordination, what specialists they have, what other services they have. So we know those clinics and know they're hitting standards that we have set around things that we're pretty sure from a practice perspective are those that we need to really care for children with spina bifida. So yeah, that's where I would start. That's the best place. Um, and all of the guys that we know really well, many of whom are on our pack, but also are leading the research on many of these areas, are in that list. Things like Lurie Children's Hospital, Boston CHOP, all of these centers around the country that are doing great research and providing amazing care as well are on that list. And there are a few other ones that might be surprises too, but they're doing the same thing that some of the big guys are, and they're just not recognized like they are.
Great, thank you.
Sure. Thanks for the question. Well, we've gone a little bit over the hour. I apologize for that, but I'm so glad that you guys took time to join us and engage in this conversation. We'll take a look at the questions that are in the chat, and if I didn't answer them, we can work to get answers to you so that you can get your questions answered. I think that's really important. But I do appreciate, number one, your partnership with us over the years, your attendance at this event, and thank you very much for all you do for those with spina bifida.
Just as a closing note too, Steph has dropped my email and her email in the chat. I know a lot of you hear from us all the time, so you probably have our emails, but just in case, she's dropped them in the chat. And I just want to reiterate, on a personal and professional note, as I stated when we started this, I have a personal connection to our mission. So thank you for investing in the mission at Spina Bifida Association and your continued partnership. None of this is possible, and the continuation of our mission is impossible without your support. So thank you so much.
I also dropped my email in the chat as well, so please don't hesitate to reach out. Night all.
Thanks, everyone. Have a good night.